Hi and welcome back to Define. Here we have everything you would need to practice and achieve your OET scores. So make sure to subscribe to this channel before we begin. Today's video session is about speaking skills of a person who is at various stage of the competency framework. For those who are new to our videos, here's a quick recap. A competency framework is a structured guide that defines the skills and behaviors needed to develop and improve in stages, helping individuals progress in their expertise. It is often used in training and development to map out growth from beginner to expert. For our use, we will use this framework as a guide to self-analyze and improve our score in the OET exam. Competency framework defines 4 stages of development. First, unconscious incompetence. Second, conscious incompetence. Third, conscious competence, and fourth, unconscious competence. Progression through these stages involves both skill refinement and self-awareness. As someone moves up the stages, they become increasingly confident, able to perform well under pressure, and can adapt flexibly to the demands of the test. Let's look at each stage in detail. In the first stage, the individual is unaware of their inadequacies and lacks insight into what they need to improve. Candidates at this stage struggle to meet the expectations of the OET speaking test, such as structuring a role play, managing time effectively, and using appropriate language. They make frequent errors but don't recognize them or understand their impact. They also have difficulty understanding why feedback is important or how to implement it. Here's a sample conversation between a healthcare professional and a patient who is at the unconscious incompetence stage of competency.
Good morning, Mr. Conrad. How are you feeling today?
Morning. I am feel better now. Medicine making me more good.
I'm glad to hear that. Can you tell me where the pain is?
Yes. No pain. Pain not here now. Yesterday, I drink much water, and pain go away fast.
That's great. Are you taking your medication as instructed?
Yes, I taking medicine every day. Yesterday night, I taked it also. It is good for me, yes?
Yes, it's important to follow the instructions. Have you noticed any side effects?
No bad thing. Only little tired. But now I walk good, more strong.
That's good progress. Keep drinking water and taking your medicine. Any questions for me?
No question. I want go home.
This conversation reflects the patient's belief that they are communicating effectively, despite frequent errors. The individual at the second stage becomes aware of their weaknesses and starts to recognize what they don't know. Here, candidates start understanding the test format and marking criteria. However, they still struggle with fluency, tone, and language use. They may realize they're missing key communication strategies, but they aren't always able to correct these issues. They actively seek feedback and understand its relevance, although they might struggle to apply it correctly. Here's a conversation as an example.
Good morning, Mr. Conrad. How are you feeling today?
Good morning. I feel better today, but still a little, weak?
I see. Can you tell me if you're still experiencing any pain?
Yes, but not much. Pain. It's smaller now? No, less now than yesterday.
That's great. Are you taking your medication as instructed?
Yes, I take it every day. Wait, no, I took it every day. In night also, right?
Yes, that's right. Have you had any side effects?
Side effects? Oh, yes, a little tired. But I think it's normal. Not sure, but walking is okay now.
That's good progress. Keep following the instructions. Do you have any questions for me?
No question. But I want go home soon, if okay.
The person is aware of their language gaps and is trying to correct them, though they may not yet have the full ability to do so effectively. At the third stage, the individual can perform skills effectively but with effort. They know what they are doing well and what they need to improve. Candidates in this stage can manage role plays competently, structuring the conversation well, and using appropriate clinical language. They're more consistent in being empathetic and patient-centered. However, they still need to think consciously about their choices and may occasionally falter under pressure. They are capable of acting on feedback and integrating it into practice, though improvements are gradual. Here's an example.
Good morning, Mr. Conrad. How are you feeling today?
Good morning. I'm feeling much better today, thank you. The pain has, reduced a lot.
That's good to hear. Can you describe the pain now?
Yes, the pain it's less than before. I would say it's only a little discomfort now, mostly when I move.
Are you taking your medication as instructed?
Yes, I'm taking it. I took it every day as you told me. I took it last night too, before bed.
That's good. Have you experienced any side effects?
Yes, just a little tiredness, but I think that's normal, right? Also, I can walk more easily now.
That's a good sign. Keep following the treatment plan. Do you have any questions for me?
No, I don't think so. I just hope I can go home soon.
The speaker here is more proficient but still needs to focus on accuracy. In the final stage, the individual performs skills automatically without much thought. They have internalized the necessary competencies. At the unconscious competency stage, candidates are fluent, confident, and fully patient-centered. They handle role plays effortlessly, adapting language, tone, and structure to fit the situation. Their responses are natural, and they manage the consultation with ease, even under challenging scenarios. They use feedback for fine-tuning, rather than significant improvement. Mistakes are rare and usually minor. Here's an example.
Good morning, Mr. Conrad. How are you feeling today?
Good morning, doctor. I'm feeling much better, thank you. The pain has almost completely gone.
That's great to hear. Can you describe how you're feeling now?
Sure. There's just a bit of discomfort when I move, but it's nothing serious. I'm much more mobile today.
Are you taking your medication as directed?
Yes, I've been taking it exactly as prescribed. I took the last dose last night before bed, and it's really helped.
Good to know. Have you experienced any side effects?
No, not really. Just a little tiredness, but that's pretty normal for me. Other than that, I've been feeling great.
That's excellent. You're making great progress. Do you have any questions for me?
No, everything seems clear. I'm just looking forward to getting home soon.
Here, the person has mastered the language to the point where they can use it accurately and fluently without thinking about the rules. The information from the competency framework helps candidates become more strategic about their preparation, making their journey to achieving their desired OET score more efficient, targeted, and motivating. Make sure to like this video, share it with someone you know, and subscribe to our YouTube channel. Thank you so much for watching, and until next time, take care.